And I'm so delighted to be here to talk about identifying and reporting medically at risk drivers, and in specifically using the film to tell a story. And what I'm going to do is just have a few introductory slides talking about how this project came about and some of the background of identifying and reporting medically at risk drivers. And then we'll watch the film and come back to discuss. I have some questions for discussion, but I'll also happy to answer any questions that anybody in the audience has. So the historical background of older drivers and the risk of older drivers goes back to July 16th in 2003. Mr. George Weller, who was 86 at the time, was out and about in his big car. I forget what it was, but it was a large car. And he was driving and turning on, in Santa Monica. He turned onto his usual street, but unfortunately on that morning, they had a street festival. And Mr. Weller had dementia, and he turned down the street and kind of panicked and hit his gas instead of the brake, and unfortunately killed 10 people on that with that mistake. This crash fueled a national debate in the US on safety risks posed by elderly drivers. And that's when the National Highway Traffic Safety Administration, or NHTSA, started the initiating of funding about older drivers. And that's over 20 years ago, and that was NHTSA seeing that this was a big crash. It was they really felt like they needed to do something, about older drivers, and the fact of the baby boomers beginning to age into the older age group. It was a really necessary funding, and they really did fund quite a bit of research in this area. So um, this is a very common slide. We know, and the research clearly shows that when you look at the rate per miles, that we know, all of us know that the 16 and 17-year-olds, the new drivers, have the highest risk of crash because they're new drivers, they're unfamiliar, they don't have any experience, and they tend to be distracted or speed. So they are the group that has the highest number of fatalities and crashes. But at the other end, after the age of 80, we also see a huge increase with older drivers dying from crashes. Now, the important thing to understand is that it's not because at 80 everybody's driving ability decreases. In fact, it's because of partly because of frailty and fragility. Is when an older adult is in a crash, they are going to sustain greater injuries and also have a more difficulty recovering from injuries. And I'm sure all of us can think of people that were in a crash or a fall, which also can, the hips broken, or they have a significant injury with a crash. They get in the hospital, they take a lot of time to recover, they become deconditioned, they go to a nursing home, and they never come home. So it's really important to reduce that risk of the crash because of frailty and fragility. So why is driving such an issue? And this was about 10 years ago. I was presenting to a law enforcement group, the North Carolina Traffic Safety Conference, and a North Carolina law enforcement officer stood and said, "Well, if this is true, when people turn 85, why don't we just take their license away?" And he was serious because he's like, "This makes sense. We have the data. Let's take their license away." And it's, I just want to say, of course I said, we can't do that. And I'm going to talk about why, but I just was reading a research article that in China, they just pulled back a law that when you turn 70 in China, you lost your license. So anybody that was turned 70 could not get a license to drive, although they just repealed that law, which of course 70 doesn't sound very old anymore. Many older adults, and this is why driving is so important, why it's an issue. Many older adults live in suburban and rural areas, and we know that. And I'm sure, researchers with dementia know that driving will remain the primary choice and personal mode of transportation. It is what people choose to do when they think of going somewhere. And we also know, and the research shows that the decision to stop driving has adverse consequences. Lower quality of life, lower health care. If you can't drive, you can't get to the grocery store, you can't get to the pharmacy, you can't get to your doctor. And older adults want to age in their communities. They don't want to go into the long-term care. They don't want to necessarily, there's many that choose to go to the retirement, the large, beautiful retirement communities, but there's many people that don't want to do that or don't have the money to do that. But everybody wants to and needs to continue to drive to maintain health and quality of life. So I'm just going to share a little bit about what we know about older drivers. And what we do know is that they're generally safe drivers. If you look at crashes per se, older drivers have the lower amount of crashes. And it's because as one ages, drivers tend to self-restrict. So, the first thing older adults do is stop driving at night, or stop, if they're stopped work, they don't have to, drive during the rush hour and they can drive when they want. They they avoid the super fast highways. The other important thing to remember is that we all age differently. So you really can't put it on a number. I mean, we can show the evidence, but I've had lots of people come up to me and tell me how, grandpa who's 94 is still driving and he's doing fine. However, there's clear evidence with aging comes slower processing speed. And that's, and what that means is with the environment of driving and things happen within seconds, if you have a slower processing speed, that doesn't mix well with older adults, and especially with their medical conditions. So as we age, we have more medical conditions and slower processing speed, and those are what makes our medically at-risk driver. The other fact that's shown in research, and this is really important to understand when we talk with older drivers, is we outlive our ability to drive. Now we age very differently, but men live 6 years beyond their ability to drive, and women tend to live 10 years past their ability to drive. So it's just that time there, we will all have to give up driving. This is a conceptual model I just want to share with you, and it's basically saying the same thing, that there's this I think there's a lot of healthy older adults living out there, community, they're doing fine. They're getting around where they know, but this green goes into yellow, and that's where changes in motor, vision, and cognition, and that's a slow process. I mean, we age slowly, and we don't even recognize the changes. I mean, many people that have, they start to get a fogginess in their eyes, and that is cataract, and you have to kind of wait until that cataract's bad enough to get it changed. So there's the vision with cataracts, that's a really quick fix, and that's one of the conditions that it's nice to have, because you can fix it and then you can get back on the road. But then there becomes this group that have too many medical conditions and the processing speed. So if we live long enough, we're going to get into that red area. But it's very important to remember drivers at any age can be medically at risk. So it's not just older drivers, it's drivers at any age. But because as we age, we get more medical conditions. So the challenge is, how do we identify or test the medically at risk driver without over-restricting our healthy older adults? And that has been the challenge of that NHTSA has been funding for many years, and we are getting closer. And one of the things is making sure that driving privilege is based on function and not age, through an evaluation of driving fitness. And that's the important key. There is one I want to share with you of, especially because this group is concerned with dementia. And there's always whenever we're doing a driving evaluation with an older adult and they say, well, I drive behind him and he seems like, he drives a little slower, but he gets there and everything seems fine. And I want to explain why that is and why someone with dementia will say, I just drive fine. I don't understand why anybody's talking to me about stopping driving. I can drive fine. And it's because of Michon's hierarchy of driving behaviors. There's three levels. So the lowest level here is operational, and that's the human machine interaction. So that is steering, brake, and using the gas. And if you can remember back, when you learn to drive, that's all you could focus on is how the steering is or how to use the brakes. And that's what driving instructors teach kids, and then they put it in a parking lot because you have to learn how to handle that 3,000-pound machine. I think a really good example is I drove automatic and then tried to learn on a standard, and that focus of how do manage the gas and the clutch is really a machine human interaction. But you learn how to do it, and then it becomes automatic, like riding a bike. So when you think of someone who has maybe very demented, they might still be able to ride a bike and they can still drive because so much of that steering and braking and using the gas pedal is motor memory. And then the second level is tactical, and that's the rules of the road. And many times those become automatic for us too. We see, traffic light, it's red or green, and we follow the rules of the road. We have left turn lanes that are specially painted on, and the big white arrows, and we have the street delineators to make sure we don't go over to the other side of the road, or we have the bumps that tell us we're getting off the road. And many of these rules of the road are also automatic for us. So that is why we can, we drive from home to work. And if you look, that's like, I don't even remember driving because you're thinking about other things. And you can because many of these are so overlearned, you follow them. Roadway design, when NHTSA funded a lot of research on roadway design, so there's lots of references that I can share with you if you're interested, that all the changes in roadway design are in fact, were designed and created to help keep older drivers safe, but they in fact are safe for everybody. A great example of that is the use of roundabouts. And roundabouts they have significantly decreased the crashes of left-hand turns that are the highest risk turns for older adults. And it's learning to use those roundabouts, but once you do, there's fewer crashes, and when there is a crash, it is at a low speed. Then the highest level is strategic, and this is where we see the beginning. That's the highest level, therefore, that's the one that's lost in first. So strategic is planning, whether you're looking outside and saying, oh, it's snowing or it's icy out there. I'm not going to go to the store today. I'll just go tomorrow. Or how am I going to go to the grocery store now that this one road is closed? And this is where we see the silver alerts come out. So, and I know I've read it several times in our local paper. Through the paper is somebody has gone off to their hairdresser or wherever and something happened that's not planned, and they get lost, and they keep driving because they don't have the navigational or wayfinding ability to get home. So this is a great, um, I use this to explain it to older adults. I explain, use it to explain to practitioners to really understand why you can't just watch, you can't just send them to a driving instructor. You can't just go on the family saying, well, I followed him down the road and he just drove a little slower, but he was fine, because you really need to test out all these levels when you do that. Um, what I want to say, when you do that driving evaluation, you have to evaluate all of those three levels. So the background of this film, NHTSA, one of the things that I got a grant from NHTSA, it was in 2017. It was a demonstration project promoting Highway Safety Program Guideline 13. And it had eight categories, and the ones in red were the one that I was able to address in this demonstration project. And very quickly, the law enforcement is a major referral source for reporting medically at-risk drivers, and that makes sense. They're the boots on the ground. When I came in with this project, one of the things we looked at is the law enforcement report was this was it. They had to go into one of these categories, and and it was very, it wasn't useful. And so we were able to get a group of stakeholders together, and we created the new form. And this is the middle section. So, the law enforcement officer can't diagnose anything, but he can, or she can check any of the observations they have. And so that was really exciting, because that was adopted by the North Carolina State Highway Patrol in 2019. So it only took 2 years. There's not much things that change in the state government that can happen that quickly. So that was a major win in this project. I went to a Vision Zero conference in Charlotte in January 2020. And based on this short presentation I did, the Mecklenburg Police Department adopted the same form of the State Highway Patrol, and they're currently using it. We created a video to train their law enforcement. So that's available at that link if anybody's interested. What also happened that was exciting at this conference is the EMS supervisor in Charlotte came up to me and said, I think EMS EMS personnel would be really good to be trained in this also. And we made plans to continue to do that. But if you see that was in January 2020, and of course, the EMS was quite busy with COVID in just a couple months later. However, at the end of the project in 2021, I had some money left over. And so we made the film Making the Call, and it was about two EMS coming across this woman who had some cognitive impairment. And that's not the film I'm going to show today, but it was the first of the two films. And in the project that I finished that with the NHTSA grant. And then we went to the North Carolina Governor Highway Safety Program and got a project with them to do education about the EMS. And I continue to do that education to educate first responders. And we also got money to do a new film, and we dedicated that film to advanced practice nurses. And that's what I'm going to show to you today, because we got a second project. Because we did the film last year, we got a second project to do the education, which is what this is part of that education. And it's really exciting. We got grant project number 3, and we're going to create a new film next year, and a film about the process of getting a driving evaluation. So what we're going to do is move into the film. I want to show you the film, and really hope that you and enjoy it. I really get a lot of want to get feedback, because we are going to do that new film, and I would sure like any feedback that this group could offer. So let me start it.
Does it have?
Eat. Steve, what do you want for breakfast?
I don't have time for breakfast. I'm running late.
You gotta eat something.
Okay, I'll have some toast. Aaron, as soon as I get in my car, I will pick up the kids from school. I will drop them off at the sitter, and I will be in court 2:30 sharp. Hello? Hello? Mom, remember when we agreed that you wouldn't fix me food while I was living here? I'll be in an apartment pretty soon.
Till you get back on your feet with your job, I'm happy to cook for you.
What's that smell? Mom. Mom, you have to be careful.
It's no big deal. It was just a little senior moment.
That's my ride. Gotta go. You want me to pick up your eye drops?
No, I'll do that. I like getting out to the country store.
Okay, okay. But please pick up my watch. It should be ready. I'll see you tonight. You promised me 25 cases. What do you suggest for the hot dog eating contest? Tofu sticks?
Hello?
Good morning, Mrs. Owens. Are you here to pick up your son's watch?
Oh, no. How do you know my son?
You've both been coming in here forever.
Of course, that's right. Yeah, and now that you mention it, I think I am supposed to pick something up for Steve.
We couldn't find his metal watch band style this time. Do you think leather will do?
I have no idea. But you could call him.
Sharon, he's gonna have to go with the leather. That's all we got.
I really just need some eye drops. Know where I can find them?
Right over there to the left of the magazine stand.
Thanks, sweetie. Oh my.
Did you find the eye drops, Mrs. Owens? Here you go.
Thank you.
You know you still have to pay for those, right?
Of course.
Let's get you checked out. Here you go, Mrs. Owens. Is your son coming to pick you up?
Oh no, he's too busy. Besides, I drove myself here with my own car.
Okay. Will you be careful out there, all right?
Get everything sorted?
I think so. But are we ever allowed to call customers families?
Um, um,
Hello? Have I done something wrong?
no, we just have some basic road maintenance up ahead. There's been a closure.
But this is my way home. I always go this way.
I understand that, man, but for today, you'll just have to take the detour. What you can do is make this right up here, make a left and another left, and that should put you back on Main Street. Does that work for you?
I suppose I can do that.
All right. Well, you have a great day, man. You drive safely.
Hello, son. I think I'm going to need your help getting home.
Pam, are you all right?
Hello, sir.
Do you need any help?
No, I called my son. Have I done anything wrong?
No, you haven't done anything wrong. It's just you've been sitting here for hours. I gave you directions to get home several hours ago.
I think you gave me the wrong directions.
Ma'am, I don't think I did. Do you know where you are right now?
Well, I'm not sure.
Is there anybody I could call?
My son, Steve,
Yeah.
his number is right here on my phone.
Well, would you let me take this back to my car really quick and call them for you?
Okay.
Um,
Tell me again what I'm doing here.
Mom, I made this appointment because of everything that's going on.
There is nothing wrong with me.
Mrs. Owens, thank you for your patience. Your nurse practitioner is ready to see you now.
Wait till you're 78 years old.
Hello, Mrs. Owens. How are you?
Oh, you can call me Sharon. And this is my son, Steve.
Hi, Jen Sharon. Hi, Steve.
Hi.
And you can call me Susan. Please have a seat. Can you tell me about why you're here today?
My son thinks I'm getting dementia.
That's not true, Mom. Dr. Roberts, Susan. The other morning, she wanted to make me breakfast, even though I told her I didn't have time. She made it anyway and burnt the eggs, leaving the stove on.
That was nothing. Everybody gets distracted.
Yes, they do, but let your son finish and tell me his concerns.
And on another day, she went to the store to pick up a few things. And the store called me and said that she seemed confused.
I just forgot what you told me. Everyone forgets things.
And the most disturbing thing is, when the police called on Thursday, they told me that they're very concerned about her driving. They told me that they submitted notice for re-examination to the NCDMV.
You didn't tell me that. What the bejesus does that
I
mean?
don't know, Mom. That's why we're here.
You don't know a lot of things. Like how to keep a job and your family together.
Oh, at least I can still remember how to get home in the broad daylight.
Okay. Okay, I have the picture. So what I'm hearing, Sharon, is that you're concerned about losing your ability to drive and your independence. Is that correct?
Exactly.
And what I hear you saying, Steve, is that you're concerned about your mother's safety and well-being. Is that right?
Absolutely.
So to your earlier question, in North Carolina, when a police officer submits a request for a reexamination, it starts a process. You'll get a letter from the DMV telling you to go and see your primary care provider. That would be me. I will need to complete the medical report form they sent you. It'll be my job to determine whether there are any current health issues affecting your fitness to drive.
Does that mean you'll take away my license?
No, only the DMV can do that. However, I would recommend that you get a fitness to drive evaluation and we schedule that appointment with an occupational therapist. Based on the results of the evaluation, we'll meet here to discuss the outcomes and determine the best plan to move forward. Does that sound fair?
I promise you, this is because I truly want you to be safe and see your grandkids grow up.
Okay. Okay. Let's get started on the testing and I'll get the, what did you call it?
It's a fitness to drive evaluation. And as I said, we will work together to meet your transportation needs. Now, does that sound like a plan?
Yes.
Great.
Thank you.
You're most welcome.
You gotta know, I'm going to do my best to pass that darn test.
I'm sure you will. But no matter the results, I will see you back here, okay? Latanya, can you please set up a time in the next 2 weeks for Sharon to get a driving evaluation from the occupational therapist? In the meantime, I really need you to go to the North Carolina DMV's website and look for the medical report form and print it out for me.
Will do.
Thank you.
How did the examination go?
Well, I'm not convinced that she has dementia. It could be something else. So in addition to the driving evaluation, let's go ahead and do a full workup the next time she comes in.
Sounds like a plan.
Steve. I just don't want to lose my independence.
Don't worry. Gonna get through this together. I'm proud of you.
Thank you.
Why don't we celebrate by going out for lunch?
Out for lunch. You know, I have plenty of food at the house. Besides, you know your father's waiting for us at the house.
What?
Just kidding.
Not funny.
Let's go to the local diner. Here they have killer chocolate shakes.
Oh, now you're talking.
Thank you for watching our film Between the Lines. As advanced practice registered nurses, you are on the front line working with individuals with diverse medical issues. The goal of this project is to raise awareness in identifying and reporting medically at-risk drivers early in the process of cognitive impairment. When a person progresses to moderate or severe dementia, a recommendation to not drive is clear. However, for individuals with only mild cognitive impairment, the correct recommendation is not always obvious. It is critical to understand that driving is the most complex of daily living tasks. If your patient can no longer organize their own medication, is not able to manage their finances, or is not trusted to cook independently, they are an at-risk driver. This is because an older adult who has been driving for 50 plus years has so overlearned the operational tasks of driving. It's like riding a bike. So even those with significant cognitive impairment can still operate the vehicle, follow basic rules, and appear safe. However, the loss of problem solving, judgment, and quick responses to a dynamic driving environment increases the likelihood of a crash or getting lost if directed off a familiar route. Thus, as a primary care provider, it's important to consider your patient's medical condition in terms of the skills needed to drive. If your patient has slow processing skills, impaired problem solving, or cognitive function due to a medical condition or advanced age, driving risks should be considered. If you have a question about your patient's capacity to safely drive a motor vehicle, there are options. 1. Refer your client to an occupational therapist, driving rehabilitation specialist for a comprehensive driving evaluation. This evaluation will include assessment of all the necessary skills, including an on-road assessment. 2. Report your client to the medical review unit of the North Carolina Department of Motor Vehicles. There is a referral form on the state DMV website. 3. As a primary care provider, you may be asked by your patient to complete the medical review form sent by the North Carolina DMV to the driver. This often happens due to a traffic violation or crash reported by law enforcement. This is the medical review form. The medical review form allows the medical review program to determine whether a person with the medical condition should or should not have a driver's license, or if their license needs a restriction. Although the form appears lengthy, the primary care provider only needs to complete page 2 and an additional page associated with the person's diagnosis. It is, however, important to answer all the questions on page 2 and ensure that page 1 includes the individual's signature. Here are some important points to clarify on the medical review form. Number 1, if the individual whose form you are completing is at great risk to the public and should stop driving immediately, you should make sure to answer no to the question F3. Do you feel the patient is medically fit to drive a car? Number 2, if you are unsure about the risk and believe a fitness to drive evaluation is needed, answer yes to question F7. Do you recommend an occupational therapy evaluation? Number 3, it is important to understand that question F6, do you recommend a road test, is not a medical fitness to drive evaluation. In fact, the road test referred to here will be at the local DMV and is the same brief road test for novice drivers. Thank you again for watching Between the Lines. While we portrayed our driver here as an older adult, a driver at any age can be a medically at-risk driver. However, as you know, with increased age, the number of medical conditions increase. A proactive plan is to encourage your older adult patients to start making transportation plans, just as they would make plans for other transitions, like retirement. The website, Plan for the Road Ahead, can assist you and your patients in this important process. Thank you for all the important work you do as advanced practice registered nurses. Well, thank you very much. And so I just have a few questions here. And, and I'd sure like a discussion. So I think what we'll do is I'll go through these questions and I'll skip to the last slide if you want my email address. Does this film have any emotional impact for you? And would this film meet learning objectives or the PowerPoints? I'd also, any feedback that how could it be enhanced? What are some of the barriers? And any advice for the next project? So let me stop sharing stop sharing and let's have a discussion. I really value any comments, suggestions, observations. Or did you fall asleep during the movie?
Thought it was powerful, really well done.
I agree. I really thought it was an interesting video for me as a new beginner or soon to be practitioner. It was really interesting because I didn't know that they would need to get the fitness eval from the occupational therapist as well as about completing the paper with the North Carolina DMV. So I felt like it was very informative.
I do want to say, I lost my train of thought with that. Sorry. Oh, I know what I was going to say. This film is funded by NHTSA, so it is available for any of you that want to use it. So it is not. I don't quite have it uploaded to the website, but if you have any use for it, you just contact me and I can give you a link to download it. So it as federal money, anyone can use this film. So you're more than welcome to use it. And if someone wants to use it outside North Carolina, they certainly can just cut off the last part with myself. So I just want to share that.
I was going to say that I really liked the bit about kind of the warning signs besides driving, and that we do see a lot of these in our patients in the clinic, and just, those should be flags to us to really be digging deeper about the driving situation before it gets to that point.
Yeah, and that's, if you can identify some of the flags, and that's where we're going to do the next one is have this same actor and her son come back. So they're from these actors are from this area, and come back and go through the driving evaluation. And the question will be, should we have her have to stop driving and have that conversation? Or very often when it's at the beginning, you can have them continue to drive, but then have some restrictions on that in North Carolina, where you're allowed to put restrictions on the license. And of course, that challenge is how, can they follow those restrictions? So it's really, it's a challenge, but that's what the comprehensive driving evaluation will help answer.
And that's kind of a question I had. So is it possible to have the two options in the follow-up video? Because that's what I usually see, is it option A or is it?
Yes.
Okay.
And that's I wonder if we could have two endings. We could have ending A and ending B, and that might be the way to do it. I'm really excited about this because we were able to get some more, more money, so it can be a longer film. So, perhaps that's what we need to do, because I go back and forth, because the conversations are very different. Well, I don't want to say very different. If you give restrictions, you start talking about, there is going to be a time you have to give up, but let's do the transition. And at that point, I really would recommend that at the end, we have the plan for the road ahead. It was also part of the NHTSA project to have that website, because it goes through, you have to plan for the road ahead, because you are going to, when you're diagnosed with something like dementia, you have to make the plan. And the last thing people want to talk about is driving. It's the last thing we want to get up. And yet it's the first thing that you have to start planning for.
And some conversation in our chat about her giving her phone up and the young construction worker taking it back to his car. And was that intentional? Is it additional vulnerability we worry about our older drivers, that they'll just let anybody help them? Or could you speak to that?
I think that's a really, in this video, we showed it as being helpful because, we like to think that there's a lot of helpful people out there, but yes, it's poor judgment in fact of just giving it to anyone. I mean, I think it's true. She was there just lost and, would sat there for hours, and that's not an unusual thing that happens.
I think the other thing I wanted to say was that I wonder if it would, it would be good to follow with the same people, but at the same time, there's also, I think, a different context when you have a male versus a female. The conversation is a little bit different. So that's another thing to keep in mind. I'm sorry for all the males, but I think they're a little bit more stubborn sometimes to give up their.
You might think so, but actually not necessarily. I mean, we do driving evaluations all the time, and I think I would say when we talk about the silent generation, that group was very more used to following their doctor's orders, but there's just as many women that as men that they may not have been as verbal about it, but I mean, if anybody you tell that you have to give up their license it's a difficult process. But I'll think about that though. I mean, that's something to really consider.
I was going to make the comment as a provider who has the talking about driving conversations a whole lot.
Yeah.
I thought everything resonated really well and seemed very realistic about everything with the scenarios that happened to the patient and their red flags and the relationship with the son and the fact that the son wasn't, neglectful. He was just busy and kind of not seeing what he didn't want to see. The only part that didn't quite ring true to me was how easy the conversation went with the provider. I was like, if only I could have a 5-minute patient driving. And I realized for the purposes of filmmaking, you kind of have to do that. But that's an interesting. It's very time consuming.
You're absolutely right, and it is a harder conversation, and you might try going back to the EMS one, because in there it was a very hard, it didn't end pretty. So that was a conversation that they drove off, and there was much more conflict in that. So maybe showing both of them is useful. But that, I think with the next one, it won't be as easy. I think we'll probably have much more pushback.
I was also thinking I really like that idea of kind of ending B. For this particular patient, just my clinical sense would be, unless it turns out it's something not dementia, I can't imagine this woman would be cleared to drive in any scenario. But I liked how the provider at the very end said, I'm not sure this is dementia. Let's also start a workup. So I could imagine one ending where the provider was sharp enough to do enough workup to find out that it was a thyroid problem or something treatable, and then she can drive. And, just to kind of also maybe make the point that is part of these conversations, is ensuring that we're not just assuming that the person's old and time to give up driving.
Yeah. But maybe we need 3 endings. I really see this next year as a challenge. With the EMS film, the filmmaker actually wrote the script and I just edited it, and we found that I had to do a lot more of the writing for this film. And the next one I definitely will, because of that will be a very, it's a very specialized knowledge area. But and we actually were just going to do it for healthcare providers, in the Governor Highway Safety. The group said, "Can you make it for everyone?" So the next film won't be for healthcare, but so that older adults, when they think about what does that driving mean, so we need to try to make it for an all population, for anybody. So that's another piece of the challenge. So, but those endings, it might be better to have a couple endings.
Yeah, I think that people want to see it in action because not many people are as familiar with the process. And I love the idea of two endings, of she's actually okay with maybe some restrictions. I also can't imagine that she would pass with flying colors.
No.
But and then the ending where, sorry, you really should not be driving, and having that kind of situation. But I don't know. What do you all think? I think people want to see that process so that they can better explain it to patients and families.
Well, that will be our goal.
I think learning what is involved in a fitness to drive assessment would be useful. And on that note, those, I don't know how much it costs in North Carolina, but in other states that I've been in, that's quite pricey to get that. And I'm just curious if there are any resources to help families who decide they want to go that route without being told by the police or their doctor that they need to have that evaluation. I know some families just want to do it on their own.
I want to say, and this is another project I'm on, or like a passion, is to educate occupational therapists in hospitals, because it is an occupational therapy evaluation, and there's occupational therapists can evaluate other activities of daily living and make a good judgment in terms of, do they need to go to a driving specialist, or can I say to this woman after doing that evaluation that you can't drive? And so in terms of the cost, through that NHTSA project, I set up a driving evaluation program here at ECU Health. The OT does an IADL evaluation that she charges to Medicare. So the client, if they have insurance, they do not need to pay that first part. And then she does a second part where I've collected data for research here in my office. And then she partners with a driving instructor. So the client only pays for the driving school evaluation, which is $125. So in Greenville, they can get a fitness to drive evaluation that's partly covered by insurance, and $125 for so that's a passion of mine, to try to get that model out there to make it less expensive. And I'm not saying that it's not, those driving instructors aren't worth that, because if they have some type of physical, they need to go through a lot more work to find the right vehicle adaptations. So
good to know. Thank you.
Any other questions? Oh, it's 5 o'clock. So, but any other questions? Or I will put my email. It's really easy. It's Dickerson, if I could spell my name right, Dickerson a@ecu.edu. And you'll also want to go to the website. You can search for Making the Call as the EMS movie, and I will be having this video up on my website at some point, but also if you contact me, I'll be glad to give you the link to download it. Particularly, I think a place that would be great would be for nursing students and other primary care providers. Students would be awesome to get them to understand this process earlier. So I see the 3 alternatives from Julie. Thank you.
I was gonna say also just like and kind of along the time, like track of like learners, but also geriatrics fellows, since we're also seeing like
Absolutely.
anyone training in geriatrics.
Absolutely. I mean, it is always a difficult conversation and but thank you very much. Excuse me. And I'm really glad that most people or all of you liked the film. It was really fun to make. And I look forward to the next one.
Don't miss that you just got an offer to have Spanish translation.
Oh, awesome. That would be great. Please email me about that. That would be awesome to put that in as
Sure, once you finish it, I'll be happy to. I think
Oh,
it's really important because it's something that is not easily,
yeah.
talked. And in the Spanish population, I know we're out of time, but it's, usually the males, the older males that drive
Yes.
the entire family, which brings a whole layer of, yeah.
Absolutely. Thank you.
All right.
Thank you. It was great.
Thank you very much. And I'll see you at the slam dunk.
Thank you so much, Anne. Everybody have a good afternoon.
Bye.